just a few little things maybe. I was wondering how, what should I have here now? Yeah, eating disorders. Have you had much success treating those, or any gyms to relation as regards treatment?
I haven't had a huge amount of success. So when you say eating disorders, I'm assuming you're talking about more
Anorexia.
yeah, so
Yeah,
things that have to do with the Shen and with the mind and the digestion,
yeah.
and are primarily Shen. Okay, so there's a few things. So some of these people will show on stomach 9. Stomach 9 is called the the reflex of primitive reflexes. So when you have things like nausea, vomiting, wanting to eat, something you can't control, suppose that's may reflect on stomach 9, which is called venying, meaning to welcome human. Okay, and part of welcoming myself is my primitive reflexes. It's also the connection between the brain and the body. So it has a lot to do with, also because of the SEM with the autonomic nervous system. It has to do with controlling of blood flow and oxygenation into the brain. So a lot of these addictive, like there's a difference between addiction and compulsion. Got to versus, like I'm pacing around waiting for my drink or for my, heroin. But there's anorexia, there's something somewhat different in a way, because you're not seeking something from the outside. You actually, you're almost seeking a behavior. It's somewhat internal. So that's one. And for that, you can use the kidney channel, and I would start with kidney 9 because by name, Jubin, the guest house. How do I occupy my own home? But it could be other kidney points. And I would also look for stomach chi points as a possibility for that, especially because it's anorexia, with things that are digestive disorders. The other big thing to look at as a treatment option is look at DO24. Because if you look at the stomach channel, so the stomach channel starts at the eye, it goes around the nose, around the mouth, up the jaw for mastication, kind of through the ear, and then up to the brain and ends at DO24. So the line from stomach 28, and it clearly says enters the brain. Okay, so the line between stomach 8 to DO24, which includes DO24, bladder 3, bladder 4, maybe gallbladder 13, gallbladder 15, and stomach 8 are all, and by the way, quite honestly, I'm not sure which is which between gallbladder 15 and 13 and stomach 8. It's a little hard to tell, but for me at least. So this line, and DO24, of course, is called Shenping, the courtyard, the reception area for the Shen. Okay, so that has a very clear effect on digestive, because it is a digestive channel. Okay, the stomach channel. It talks about taking in everything from the world through the sense organs, the eyes, the nose, the mouth, the ears, and bringing it to digesting it inwards, making it yours. So DO24, practically speaking, and this whole line can be very useful for those kinds of things. And other than that, treat the autonomic nervous system. Usually with anorexia, I mean, I guess it. Does Camille will know the answer to that. You don't have to unmute yourself if you don't want to, Camille. Anorexia and anxiety seem to me like they may share a root, but etymologically, but usually in anorexia there is, that there's an anxiety, there's a nervous system component that's strong. So I would smooth out the nervous system to the extent that you can, etc., etc.
Well,
Go ahead.
okay. So I did unmute myself
Thank you.
because it's really not hard. Is the road noise okay? It's not disruptive?
I'm not hearing it.
Oh, good. Okay. Well, that was my concern because I have good Bluetooth, and so having been anorexic myself as a teenager, I also would want to bring in the metal component because it really, to me, is an interaction between metal and earth, to a very large extent, because a lot of the reason people are anorexic is because they're trying to be good enough. They're trying to be, they're trying to make themselves perfect, and this is their view of what perfection is. And so I think that there's a lot with the lung. I think there's a lot with judgment and morality and all that sort of thing. So I don't know if that puts any other take on the Shen. I put it, generally speaking, I don't really think people with anorexia are anxious. I think of them more as being depressed, really.
Oh, okay. Well, but they're anxious about, perfectionism is a form of anxiety, isn't it?
Well, I mean, I guess I'm just putting it in the context. I don't know that I would. I mean, it's definitely in the heart realm because of the Shen, but I don't know if it's in the heart realm. Like the little Shen, the little heart, as opposed to the big Shen, the big heart. I don't know. I just see depression so much more, and I mean, I do think that there's also very much a hormonal component to it.
Yeah.
It seems so prevalent in young women right at the onset of menarche.
Yeah.
Yeah.
So I don't know if that also creates a slightly different take on it.
Yeah. No, I would, definitely. And also anorexia itself affects hormones. So it has, I mean,
right. There's the duality of, you start losing your menses and all of that because you're not eating.
Right. So how much of say something like the Chong is involved? Because it's about, is it about being the ability to make transitions in life through the 7 and 8 year cycles? So
that's an interesting thought. Well, and that's very much true in terms of kidney because it's the will. I mean, you are very much trying to assert your will, and you see that all the time, that it's a way of taking control of your life when you feel like that it's out of control, and I can see that a tremendous amount in young women.
Yeah. So a lot of that for me would be kind of, it's not that it's outside the scope, it's, what I would do is I would take these ideas and then see what they have in the body and see if I can apply those ideas on the body. But in terms of what I think like physically reflects, and I can say pretty automatically is likely to work, is they are likely to show stomach 9, they're likely to respond to kidney 9, stomach chi, and do 24. And there's always, because a person who comes for anorexia is, if it's really just, I'm just coming for anorexia, which basically is they're already halfway on the mend at that point, because, I mean, because I don't know if Camille, you would agree, but I when a person says, yes, I actually don't want to have this, I see this as a compulsion, you're already kind of, you're not past it, but you're already towards resolution, hopefully.
You've taken the most important step. I agree completely.
Yeah. So, and most people, so if that's really the only reason why they're coming, as opposed to, by the way, in my background, I'm coming for shoulder pain, or I'm coming for blah, blah. And by the way, there is anorexia in the background. Those are slightly different things. But if they're coming for, especially if they're coming specifically for anorexia, then a lot of, a lot of what I would do would not be involved just with palpating and needling. There'll be a lot more going on. And then the needling may reflect, my choice of points may reflect some of the, I don't know, the psychological revelations that come through. I don't know how to exactly, you know, but it's kind of interesting
Well,
because for me, yeah, go ahead, Camille.
no, go ahead. Go ahead. It's kind of
Well, what I was,
interesting. What you're
okay, well, what I was going to say that, you know, like for me, it's sometimes it's almost like I'm two people operating. There's a part of me that can operate very much, okay, let's see what your body says, let's fix that, you know, blah, blah. And there's a part of me that can be very much, you know, talking philosophy, psychology, blah, you know, like doing something that's very not body oriented. And the trick is how to bring them back together when the
Right.
person gets on the table. And for some people, I mean, in fairness, and with all due respect, for some people, the work we do with them, talking to them, is way more useful than any needle that I would put in them. And I would consider myself as someone who is definitely interested in needles doing something physically and showing the effect right there and then, et cetera, et cetera. I'm not one of those people who like, well, you know, this point has this fabulous name and it's supposed to, you know, it isn't, you know, I, you know, I want to see the proof on the body. Okay. But also to accept that sometimes, you know, you do need to go, the body is not the whole picture, and what the body reflects. I will use what the body reflects as a way to ascertain that I'm not just bullshitting myself. I'm not just making up stories for the sake of it. I have a way to ascertain them. So sometimes, you know, it's like someone possibly with anorexia, the main part of the treatment may not be the needles, but maybe whatever support I give them on whatever level.
Well, I think that's very true. And if I am going to do needles, I honestly wouldn't even think of Kiko. I'd go with Jeffrey. I mean, I can think of 6 or 10 treatments of Jeffrey's that I would do before I would do a Kiko treatment. Honestly, I mean,
No, no,
you're
that's
looking. Well, I mean, yes, absolutely. I agree on the Chong. You're looking at a ruptured renmai. Um, um,
and yin wei also.
and I would say yin wei is absolutely, and you would even look at daimai because there's a lot of buried in the basement.
Well, you have so much accumulation that you're unwilling to accumulate anymore.
Well, yes, and there's an incredible amount of buried trauma there. So I would probably, I mean, honestly, I would probably start with a joint Chong Renmai, doing Chong on one side, Ren on the other.
Mm-hmm.
And by Ren on the other, I mean, of course, the only thing that's going to be on the other side is 1/7, but still,
So you're talking, sorry, Camille, you're talking about the opening, the opening points, and
well, in Jeffrey's teaching, you also trace out the trajectory. So you would pick pertinent points along the channel, or just the major points along the channel. So you would first open it, and then you would pick important points. Like, for instance, the most important point that comes to my mind is Ren 6, because that's the mother of the mother. And
Whoops, you're
so
cutting out.
you would. Sorry, I'm driving under some underpasses, so for just for a moment. Okay, so I'll repeat. So, for example, I agree that I would probably start with Chong. So I'd probably, if it was a female, I'd start right side Ren, right side spleen 4, and then I pick some important points along the Chong, and then I would start up the Ren 2, Ren 4, Ren 6, definitely Ren 12 because it's the stomach, probably Ren 17, and then I would finish with left side lung 7. So that would probably be starting point for me, and then I might add in some essential oils for the Chong and the Ren. I probably also encourage them to go home and do hot packs on their Ren, at bedtime, that kind of thing. And then as I got to know them better, then I would probably do some opening up of the daimai and see what kind of trauma came out, or maybe some low vessel treatment at that point to see what came out, depending on whatever specific manifestation of the low. I think I have sent Jeffrey's list of the emotions that are associated with each low channel. So I would look, are they suicidal? Are they alienated from society? What low issue might they be having? And because that's a really important, when you do the low treatments, then you do the harmonize the blood treatments, and that's harmonizing the Chong and the Ren. You're doing liver 11, you're doing stomach 30, liver 3. I mean, I think that that harmonize the blood treatment is fabulous for is fabulous for building them back up and putting them back together after you've ripped all the trauma out. Jeffrey, I think, would hugely say that a lot of these issues reside in the blood, in the yin level. That's why it's affecting them in terms of their spleen, in terms of their eating. I don't know. I'm just kind of talking off the top of my head while I'm driving. So I don't know. Feedback? Anyone? Comments?
No, that's okay. So I will say, the thing that jumped at me was that I tend to, if I'm doing the Chong, I don't tend to associate the Chong with the Ren at the same treatment. I would do the Chong and the Dai at the same treatment, though. Interestingly enough.
Oh, really?
Yeah, and the reason why.
Wow, top and bottom?
Top and bottom. Well, I'm not sure what you mean by top and bottom.
Because it's the most superficial at 8x and the most deep 8x.
Okay. That's fair enough. But if you're connecting someone with their core, with a Chong, they're bound to come up with issues. So you need to give it it's good to give it an outlet. So you want to open up the Dai. The way I look at it is I do the Chong to connect them with their sense of who they are. And as they encounter issues, so part of my Chong treatment would include Ren 15, by the way. So in a sense, I am tapping into the Ren because that's the low of the Ren. Okay, so I'm giving them, spleen 4 is already a low point, and Ren 15 is a low point for the Ren. So I will do Ren 15 as if it's part of the Chong, and then I'm not sure what the kidney number, I think 22 is the one that's next to it or something. And then, so that actually gets almost like 3 points. So like if I do Chong, I do stomach 30, kidney 16, kidney 20, the last one on below the ribs, whatever that is, Ren 15 and kidney 27. That's kind of, what I'm likely to do on, for the Chong. And then I would add gallbladder 41 and gallbladder 26 to open the Dai to give it some outlet. And then I would give it an extra outlet by doing pericardium 6, not so much as a couple for spleen 4, as much as to open the chest. So it's just interesting that it's,
Yeah, I'm going to have to go write that one down and think about it because that one kind of blows me away.
Every time you
if I had that treatment, I'd have to do nothing else for 3 days.
Well, but that's pretty much what Jeffrey suggests.
Interesting.
I meant to do nothing for 3 days. He says that you're supposed to be occupied. This is supposed to get you going. That you're supposed to, get into the depth of it is going to possibly can be overwhelming for 3 days. That's
why I say that, because That's opening up a lot at one time. Wow.
in a sense, but yeah, I don't know. That's what I've
I
always
mean,
done, so
respectfully. I mean,
no,
I'll try it.
yeah, why not? It's like,
No, that's what Jeffrey always says. Try it on yourself.
right, uh-huh, yeah.
So, yeah, why not?
Yeah. Anyway, so yeah.
Interesting.
That's
And
very interesting.
Now, I will say one more thing. When I do use these ideas, like, Jeffrey's ideas of, and I personally don't have a huge resonance with the low channels, with Jeffrey's idea of the low channel, partially because I don't
Oh,
really like to,
really?
yeah, I don't really like 7 stars to begin with and stuff like that. But generally what I would say, well, it's number one, I don't resonate well with 7 stars. I also don't, because my understanding of what I do as an acupuncturist has a lot to do with um, manipulating connective tissue. This is manipulating blood, so it's not my comfort zone. My comfort zone is more with needling because I'm getting or moxa, where I'm actually either dissolving or breaking down connective tissue. So that's just my. But I will.
Have you seen him do low treatment though?
Of
Like,
course.
because I know he doesn't treat. Okay, because he's so, like, he barely touches the skin.
Oh,
with
no,
it.
no, no. I know. No.
Okay.
Yeah. No, he does. So yeah, Jeffrey doesn't bleed. He doesn't do, he's not really interested in getting, he
He's
keeps
not a
swiping
Miriam
it.
Lee.
Sorry?
He's not a Miriam Lee.
Oh no, he's definitely not a Miriam Lee, no. Uh, well, he's using a 7 star, not a Lancet, first of all. But no, so he just taps it very, very lightly, and then he keeps wiping it with alkalized cotton. And the moment the cotton has some sort of brown tinge to it, so you don't see blood, but the cotton tells you that some blood has come out, because you see that the cotton now is not clean. It's no longer white. It's not pristine white. It has a little, it doesn't have a drop on it. It's not like you're seeing blood, but you're seeing something a little brown. Now, of course, if they were wearing makeup, you can't use that. But so yeah, the amount of blood is different. So no, I meant literally the 7 star itself. That the tapping. It's not the same for me. Because I'm not connecting with a person's body in the same way. When you're holding a needle, you're feeling what's happening underneath the skin in the person.
Yeah,
I don't have that capacity to do that with a 7 star.
Well,
I'm tapping it, and I don't, maybe I haven't done it enough or whatever, but it's just my capacity.
I mean, it's not as precise and sure as Kiko, and it's a little more Russian roulette. Maybe I got it, maybe I didn't, but I'll tell you, when you get it, it's life changing for people.
Yeah,
I
life changing
for people.
So what I would say is this, though, regardless of what you're using, what I would do in a case where I'm moving towards that realm, the more Jeffrey style treatments, what I do is I still palpate the body. So let's say I talk to a person, I went, oh my God, you are just so Chong, you're so whatever, like I've come up with, and then what I do is I still restrain myself by checking their abdomen, and then checking the abdomen, I may get ideas from, like so-called Kiko protocols or whatever other protocols I have. But then I say to myself, and I really thought the Chong is their thing. And then what I do is I say, press on spleen 4. And I see how much it clears the abdomen. Or I press stomach 30 to see how, I'm trying to extrapolate my Chong ideology and see if it will actually move it in the body. Now, Jeffrey says he can evaluate it from the pulse, but I'm someone who, I'm a lot more primitive, and my capacity of evaluating the pulse isn't that big. And in fact, one of the way Jeffrey evaluates treatments to a large extent is what happened to the pulse, how do you reinterpret what's happening in the pulse, and where do you say the issue, if you felt the issue was at this level and in this organ, do you feel the treatment shifted it, and towards where? and that suggests to you what your next treatment might be. And when they come to the next treatment, you check if that's still the case, or has it shifted further, or whatever. So I don't have this capacity of saying, oh, I can feel your frustration of blah, blah, blah in your small intestine pulse. I just don't have that capacity. And worse, I mean, well, actually, what's more important is not just that, but the ability to needle or touch a point and evaluate that the pulse changed and be sure that it's about what you did as opposed to the pulse just changed. I mean, that requires a tremendous amount of concentration and a tremendous amount of capacity that I've never developed. My capacity is in being, to a degree, I can take a pulse and tell things from it. I can hold my concentration there, but the moment I start touching points and stuff, my concentration went away from the pulse. And I can't maintain the concentration in the pulse reading enough to be able to say, oh, and here's the change, and here is exactly what it means, and make more of it. I mean, it requires a lot more than I'm giving it.
Well,
But
I think for me, with low treatment,
Mhm.
I know when I've achieved the result when they start sobbing for 20 minutes about something that happened to them when they were 6.
Fair enough. So you just have to make sure
You
that
know, and the patient is 73 years old,
yeah,
that kind of thing.
yeah, no, yeah, and you just have to make sure that there's that you don't need the room right away afterwards, because you can't say, well, I'm sorry, but our session is over. You need to leave because
well, that's why you get to know your patients lots of time the first time. But if I could add in another treatment
yes.
that I would do for this, by the way, and it is in the 8 extra realm,
Mhm.
is a treatment I have used in many applications with incredible success. Is it's a stabilize the Chong treatment, and it's from Jeffrey, and it's really simple. You open spleen 4 on the appropriate side, usually women. And you moxa UB39, and you needle kidney 26. So you're basically 3 needles and then 2 moxa points, and it's a profound treatment. Profound treatment. Like, I had one lady in her early 40s who had been infertile for years, and in the first treatment she had twins. So it's like stabilizing the Chong really has many, many applications, but definitely I think would have applications here with anorexia or other eating disorders, which we haven't really talked about. The others, like bulimia, is another key one. And that's a very, very different thing, because that's a lot of liver attacking and all of that. But I think it's still depression. Now, bulimia, actually, I might put more of an anxiety component on bulimia.
Interesting. Thank you. Yeah.
I don't know.
Yeah. So what I think the thing that I would do different for bulimia, like dogmatically in terms of body findings, in bulimia, that there could be a greater involvement. I wouldn't because I don't use the terminology of the liver attacking the spleen kind of thing. I would say that there's a larger, the diaphragm, tightness of the diaphragm could be, more prevalent there. So I would look at that. And the other thing is, because it's I would look at also possibly do 16 as well, but more possibly I would replace do 24, sorry, with do 22. I would go further back. So that happens when people have, so So we generally talk about, like, if we say something like somebody, we say people's sympathetic nervous system is too active. And if we say to someone, the parasympathetic is too active, it doesn't make sense to most people. How can my parasympathetic system be too active? I mean, isn't healing about bringing people into a parasympathetic mode? And yes, the answer is yes. However, um, there are situations that where the parasympathetic, in at least on a local situation, and that's happens specifically in digestion, is overly active, because most digestive functions cannot happen unless it's under parasympathetic control. So what happens is the person can actually be sympathetic, but in their digestive system, there's, the message isn't getting there. Because if you're sympathetic, you should not be digesting. So the question with bulimia is there is a possibility in that where the parasympathetic might be actually active there. And I would look at when that happens, people who have overactive digestive system, like they may have diarrhea, nausea, blah, blah, things like that, do 22 is more useful often than do 24.
Mm.
Okay, so I would, and by name it means nothing. By name, I think it's called fontanelle, the meeting of the fontanelle or something, Shinwei. So it's not like do 24 that has a lovely name. So, from in terms of body wise, as opposed to, psychological outlook, because I would still look at stomach 9 either way with bulimia also. So, same idea. The one big difference is that I'm inclined to consider do 22 over do 24 in treatment.
Mm-hmm.
That makes sense. And to release the diaphragm in whatever manner I can.
Yes. And just in regard to like the ANS component, I find, when you talk about the pulse, the tight pulse,
Mm-hmm.
disappearing on pressure,
Mm-hmm.
I find most people's pulse kind of changes or disappears on pressure.
Most people's,
yeah, most people's pulse that I take, to me, they seem to kind of change or disappear.
often, yeah. Okay. Well, so there's a number of things. I mean, it's a possibility that, well, okay. So given that you're in Ireland, where you guys are supposed to have soft, slippery pulses to begin with, because you're living in a soft, slippery environment, so it should reflect. But so if you're saying I'm finding tight, a lot of the people I'm finding, most of the people I take, they're tight at the top. And then when I press they're soft, it might be that it's within the nature of the environment that you're living in, that people will have softer, slippery natures underneath. And that's just a given. I don't know, because I haven't taken enough Irish pulses to be able to tell. So what I would do is I would look, is it tight at the top, meaning it has a sharpness to it, but it isn't big, it's not wide, it's not an excess pulse. Okay? As opposed to wiry, which has the quality is the same with wiry, but the strength, the width of the pulse. Wiry is a definite excess pulse. Tight is a deficient pulse. That's the difference between the two of them. So wiry would be a big excess strong with like a violin string quality to it. A tight is the violin string quality to it, but it has at the very least it's thin. Sometimes it's weak also. It isn't always weak, but it tends to be. It's often weak. Okay, and in this case, it also, upon pressure, it loses the tightness. A wiry pulse, a true wiry pulse, according to the 21 pulses or whatever, the Li Shijian's ideology, a wiry pulse does not. It has strength, it has very strong root. It's an excess pulse. You press on it and it's still, So, and it's also possible that the kind of people who come to you, a lot of them have autonomic nervous system issues.
Yeah.
So you either, what I would say is, if you're seeing too many people of that nature, it means that you're not able to differentiate.
Yeah.
Because it's just the nature of it. There's no, listen, even if you were seeing 300 people a week, but 297 of them have the same pulse, that pulse lost its clinical significance until at least 100 a week show a different pulse, and then you can have a comparison. So it's not like I'm not experienced. It's my experience is limited by it's just like someone who only treats endometriosis. That's all they know. They only know endometriosis. It's like, well, can you treat my thyroid? No, I can't, because I only do endometriosis. It's just the nature of what I do. So it may be that for whatever reason you have tight pulse types that come to you. And I would say ignore that because you don't have a way to compare. So it may be, it's really interesting to see. Of course, we're in weird times right now, which can affect people's pulses also, but but it affects also how many people we're seeing and who we're seeing. At some point when you let go, you say, forget this pulse is irrelevant to me right now. Avi gave me permission to let go of the pulse. Everything's good. So once that happens, you may start seeing people with different pulses, and then you'll be able to say, oh, okay, now I can make some assertions about it. But if everybody has the same pulse, we can't make an assertion on it. It's like ridiculous. It makes no sense.
Yeah.
Does that make sense?
Yes.
So
Yeah.
I would just, like, for a while, just let go and don't deal with the pulse. It's okay. Because it's a little bit like, well, like when you went to school and there were basically two types of pulses. There was the slippery and the wiry. And, there was very little else. And, you are scrambling to kind of like be able to say one or the other and be approved on, that what you said is like correct. And then, of course, some other teacher was going to tell you the exact opposite. It's always like you have two quote unquote experts taking the same pulse and they're both coming up with totally different conclusions. It's okay.
Yeah.
There are other tools to be used. And that tool of the pulse is primarily, and it can be very useful, but the biggest time that you want to use it, which is not going to be all that often, is, do I needle under the third toe, with a slow pulse. If the pulse is slow, you do not want to needle under the third toe, unless they very clearly have that tight pulse that either disappears or changes quality on pressure. How often does that? It's like the majority of the patients are not slow pulse to begin. Like, yes, there are some. So you're missing a relatively small proportion of the population by letting go of that for a while.
Yeah.
So I wouldn't worry about it too much. And I think there's a chance that if you let go, you might be able to open up, or things will open up externally for you, or whatever, to bring other pulses that will then give you better confirmation of oh, okay, this is it, or this is not it.
Yeah. I don't rely on it too much anyway, really.
Yeah, then
Yeah.
throw it out the window. It's not.
Yeah, but I was just trying to get better at discerning, really. So it's just I was finding a lot kind of similar.
Yeah. So, and I think that right now, given that, well, I don't do enough pulses and enough discussion of pulses with other people to be able to contribute. But what are the pulse changes in people in the current environment? There's some discussion of what pulses people might feel in COVID patients, or former COVID patients or whatever. But as a society, it's like I think that most of us are a lot more anxious. than we claimed to have been a year ago, or at least we've been given that.
Sorry.
No, it's okay. I accept that you just know. I'm kidding. I can see clearly that you disagree with the statement.
No, I do
No,
not.
I know you're saying it's an understatement. But I also think that part of it is that we've been given license to acknowledge being anxious. Whereas a year ago we were given license to, up until a year ago, for about 20 years, we were given license to say that we're very busy, we're under a lot of stress, but we were not allowed, as far as our perception of ourselves, to say that I'm anxious. That was not a, it's like you're acknowledging this terrible weakness that, I'm stressed. Whereas now, if you're saying you're not stressed, like, what the fuck is wrong with you? Like, are you oblivious to what's happening in the world? I don't want to be near you because if you're not stressed, you're not going to wear a mask when I'm around, and I'm going to get infected. My anxiety, my tight pulse is going to come up. So it's hard to know how many of us have developed a tight pulse as a result of cultural changes. I honestly don't know. Partially because, I don't discuss it as much with other people, and also because it's not my field, and also because the number of patients is just so much lower. I don't have as much opportunity to like check things out and like experiment. And yeah. Let's think of something else about, how when the lockdown began and these sessions were kind of, more people were coming, and it's kind of, no one's interested in learning anything. We have the time to learn and explore, but there's nothing to explore in a way. We're kind of stuck.
Yeah.
So it's an odd, but that's another demonstration of, like, everything is so contradictory in the environment. We were not used to the environment we're living in. We're kind of we're all, like, desperately, or not so desperately, but we're trying to adapt, and we don't know how. So the pulses may show, this sort of, they may not have well, they have an autonomic nervous system because that's what's happening, but it may not be a disorder. It may just be an adjusting capacity. They're just trying to adjust to what's going on. It's not necessarily a pathology, it's a response. It's not yet a pathology. I don't, who knows?
Mm-hmm.
Well, I'm sure there are people who do know, but it's not me. Anyway, so
I have
anything
a
else?
question. Yes,
Yes.
I just a quick question actually for Mary
Yes.
Jo, which is, eating disorders are so prevalent in the United States, and I'm just wondering your perspective on how it is in Ireland, how it is in Europe. I mean, is it as bad as here, or I mean, is it it's so common? Is it that common there?
No, I wouldn't think it's very common.
Okay. That's what I would have thought. So,
yeah. Yeah, no, not that. No, it wouldn't be common, but I don't know percentages or anything, but yeah, it wouldn't be a commonplace thing in general.
So people are pretty healthy about their self-image.
Yeah, and as you say, I think a lot of the cases would fall into that kind of, like early teenage, like, a time when there is that hormonal component. That most of the cases kind of, I think, tend to fall, around that. We see them around that time.
I think it has become so common here. I mean, not just because there are so many people that are overweight, which is a very simple solution, but I mean, or a simple perspective, but there's so much of it now has been the shift in sexuality that young women are going through, of of feeling that their sexuality is worthless. And I think that there's so much of that in American society right now, to the point where slang for genitalia is junk. It's like, show me your junk, girl, you know, and so you feel this sense of worthlessness. And I think that there's so much of a desire to just like, what can I do to make myself better? What can I do to make myself more desirable? What can I do to make myself more acceptable as a human being? And it's so prevalent in our society. It's heartbreaking. And I mean, it's tragic. It's really tragic. So I just, you know, I was just curious, you know, because it doesn't seem, you know, I haven't been to Ireland, but I haven't seen it nearly as much in other European countries that I've spent time in as I have here. So yeah, so I was curious. So you've just confirmed what I thought.
Yeah. I suppose location would be a factor as well. You know, I think probably, you know, maybe in the bigger cities, you know, where I am, it's kind of a very rural area as well, you know.
Yes.